A common question I get asked is, should I have Coolsculpting or Liposuction? So I'm gonna try and give you the pros and cons of each to help you kind of make sense of that question. So let's talk about how they each work. So Coolsculpting works by putting cold suction cups on your body, and it relies on the fact that fat is sensitive to cold temperatures. In other words, your skin doesn't get frostbite because skin isn't as sensitive to cold temperatures as the fat is. But the fat theoretically gets somewhat killed. In other words, it's causing injury to the fat cells specifically with the cold temperatures, because fat cells don't like cold temperatures and they're more sensitive to damage caused by cold temperatures. So that is essentially how Coolsculpting works. That's the basis of how it reduces unwanted subcutaneous fat. Liposuction, on the other hand, is a more invasive procedure. It involves a small incision to get a cannula between the skin and the muscle layer of your body to suck out the unwanted fat. So the pro of liposuction is you can see the fat coming out. There's no question that it is being removed from your body and gone forever unless we put it back somewhere else, like in a Brazilian butt lift. So I'm a big fan of liposuction because I'm a plastic surgeon. I feel very comfortable doing liposuction. I do it all the time. And so I prefer liposuction because I know what we're gonna get, and I can do more sculpting. I can be a little bit more of an artist and take a little bit more fat out of one area versus another to achieve the contour that looks good. So I'm a big fan of regular power-assisted liposuction, as I'm sure most plastic surgeons are. Now, the great thing about Coolsculpting is it is not invasive. It doesn't require any needle sticks. It doesn't require any incisions, and anybody can do it. So if you're going to get Coolsculpting done, you're probably going to be seen by a doctor maybe, and then a nurse who runs the Coolsculpting machine is going to hook you up with the suction cups, and then you hope that the cold temperatures hurt the fat. So I think a lot of it depends on your goals. If your goal is to have a dramatic, reliable result, meaning you want to see a significant change, I would strongly consider getting regular liposuction so you can actually see the fat come out of your body and know that it is gone. If you would not have an invasive procedure done and you don't want any incisions or needle sticks or anything like that, then you could get Coolsculpting because it's less invasive. The risk that you take is that you don't have the result or the improvement that you want. A lot of patients, I don't own a Coolsculpting machine, in full disclosure. I see a lot of patients who've had Coolsculpting done and they are frustrated that their skin is still loose, but Coolsculpting isn't supposed to tighten up your skin. That's not what it does. And they're frustrated that they didn't see the result that they wanted, meaning they can't really see a change at all. So in that case, I treat them with liposuction to achieve the goals that they wanted, and they're oftentimes frustrated that they didn't just get liposuction to start off with. But again, I don't see the happy patients after Coolsculpting, right? I only see the patients that wish they had gotten a better result from Coolsculpting. So I'm not gonna sit here and bash Coolsculpting. I'm just gonna explain that what you're trading off, what you're trading for if you get Coolsculpting is a less invasive procedure for a less reliable result. With traditional liposuction, it's more invasive, there's more recovery, but there's less variability in your result, meaning you're gonna notice an improvement. With Coolsculpting, it's low risk, it's not invasive, there's minimal recovery, but you might not notice a difference. So you just gotta ask yourself, is it worth spending money for something that may not create the improvement that you want? And that is ultimately where the decision lies. I would recommend that you consult with a plastic surgeon who can counsel you one way or the other, because my concern is I see a lot of patients go see a chiropractor or a dentist to get Coolsculpting, and chiropractors and dentists, with all due respect, don't really know how to counsel patients when it comes to what treatment option is best for them. So before you waste a bunch of money on Coolsculpting, you want to make sure that it is even possible to achieve the goals you want with Coolsculpting. I have seen patients come in with a ton of excess skin on their abdomen and excess fat. And I know the only way to achieve their goals and give them the body they want is with liposuction and a tummy tuck. Yet they kept getting sold Coolsculpting by a non-plastic surgeon physician for almost a year with little to no improvement. And so that's a situation where I just really feel bad for the patient that they were kind of led down the wrong pathway. So I hope that this helps. I hope it sheds some light and helps you make sense of your options regarding regular liposuction versus Coolsculpting. And the last thing I want to mention is you don't have to go to sleep for liposuction. Any area of your body that you could treat with Coolsculpting, which does not treat huge areas at a time, can absolutely be treated with liposuction under local anesthesia only. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.